Good morning to the Honorable Ministers of the Council, members of the media, online viewers, radio listeners via St. Martin Gov Radio 107.9 FM and respective radio stations island-wide. I'm Rolika Roach and welcome to the live Council of Ministers press briefing for today, Wednesday, July 28th, 2021. At this time, I would like to invite the Minister of Justice, the Honorable Anna Richardson, to address you. Minister Richardson, you have the floor.
Good morning, Honorable Prime Minister, colleague ministers, members of the press, Ms. Roach, the DCOM team, listening and viewing public. We are touched in many ways by the passing of Mr. Lance Thomas. With respect to the family and in light of the ongoing investigation into the passing of Mr. Thomas, I am not in a position to answer any questions at this time on this matter. This is the case until the investigation by the national detectives has been concluded. As Minister, all necessary actions will be undertaken that may be deemed necessary following the results of the investigation. To facilitate and ensure that the investigation can be conducted prudently and thoroughly, I respectfully ask for your patience. Information will be provided to the family of the deceased and then to the public as soon as humanly possible. For that, this is my opening statements for now, and I'm available for questions on any other subject matter. Thank you.
Thank you, Minister Richardson, for your opening remarks. At this time, I would like to invite the Minister of Tourism, Economic Affairs, Transport, and Telecommunication, as well as the Acting Minister of Public Health, Social Development, and Labor, the Honorable Ludmila De Wever, to address you. Minister De Wever, you have the floor.
Thank you, Ms. Roach. Good morning, Honorable Prime Minister, Minister Richardson, Ms. Roach, members of the media and the viewing and listening public. Yes, as Ms. Roach said, I'm holding two portfolios this week, so I'm just trying to organize myself. Just a quick update from the Ministry of TEAT. Regarding our activities in this past week, we had Diamond PR firm on the island on their familiarization trip to get to know the island. They were staying at various properties just so they get a better mix of what we have to offer as hotel stays. The team also participated in land activities such as steel pan classes and visited Parrotville and Rainforest Adventures. A stakeholder presentation was given and there was time for them to interact with many of the stakeholders from SHTA, the airport, various hotels, and so on. One of the other exciting but delayed by a week opportunities that was coming from the Tourist Bureau is the Real Madrid football clinic that is taking place this week. It was originally scheduled to happen last week. The St. Martin Tourism Bureau is pleased to announce a successful kickoff on Monday, July 26th. The organization Fundación Real Madrid clinics Dutch Antilles, together with the Real Madrid Foundation and our local partner Flames United FC, our football club. They started the Foundation Football Club for Girls for the ages of 6 to 13 years, and it will run until this Friday, July 30th. The goal of the organization, in conjunction with the sponsors, is to motivate the practice of football on the island, as well as to encourage the values inherent in the sport, to give them the opportunity to train as their idols do and contribute to their personal development. In addition, a great opportunity to grow the sport tourism sector of St. Martin. One of the other developments that came out of this project is that the foundation wanted to coordinate activities with other foundations on the island. So they were put in touch with the Nature Foundation, and they're doing beach cleanups with the kids, with the foundation members, with the players, and the Nature Foundation. The collaboration of this is thanks to the help of Adidas, the main sponsor, Coca-Cola, CC1, and there's about 65 kids that are participating in this clinic. As it relates to the Ministry of VSA, As of July 27th, CPS has reported 2,729 confirmed cases since the outbreak started in March 2020. St. Martin is now trending at 5 to 7 cases per day. Recent genomic surveillance data from the RIVM indicates that 37.5% of our cases are Delta variant, with the remaining portion being Alpha variant. It's important for me to point out that the article from the Daily Herald yesterday, the front page article with the RIVM announcement that over 70% of our cases are Delta variant, that data is 2 weeks old. So I would like to caution the public that when we are sharing, it's a week later, and we have to take into consideration that when we get our results, it's from the previous week and a half. So the update this week, as I said, is 37.5% of our cases from the past week's reporting is Delta variant. Whereas the previous week, last week, as Minister Vyasa Otley announced, and I alluded to in my dialogue for people to continue being safe, is that back then it was predominantly Delta variant. A week later, that is the change. I continue to encourage persons who are experiencing signs and symptoms of COVID-19 to come forward for testing. The drive-through testing in Point Blanche remains open daily. I think it's important for the public to be aware of this, because I myself, in my role as Minister of TEAT, have been reached or contacted several times in the last 4 days to find out whether or not the drive-through testing site at Point Blanche is still open. It is still open. It is open from Monday to Friday, 8:30 a.m. to 11 a.m., and on Saturdays, 8 to 11 a.m. As we have been saying for over a year, 914 is your number to contact should you feel the need to speak to anyone in CPS to get guidance on the actions for you to take if you have any symptoms of COVID-19. Related to vaccinations, this week was slated to be the last week of mass vaccinations. The vaccination center at the Bel Air Community Center will have its last clinic on Thursday, July 29th, and will be open from 8:30 a.m. to 4:30 p.m. On behalf of Minister Otley and the vaccination management team, I would like to extend a thank you to the management of the Bel Air Community Center and Caribbean Cinemas for hosting these vaccination clinics. I would also like to thank the countless volunteers and VSS staff who over the course of 5 months contributed their time and energy to ensuring a successful vaccination campaign. I am pleased to announce that as of Monday, August 2nd, CPS will continue to administer COVID-19 vaccinations without the need of an appointment. This is to guarantee that all persons who want to get the vaccine can still do so during a time that is most convenient to them. Out of the entire vaccination update, one of the most important to figure out that I will rely on the media to help us share is that walk-ins for the vaccination will be accommodated from August 2nd to October 31st at the CPS office, which is in the Vineyard building. As a reminder, St. Martin is now vaccinating persons aged 12 and up. Parents and guardians, please get your families vaccinated, and if there are any questions or concerns, contact your doctor's office or CPS for more information. This week's pop-up vaccination clinic will be on Friday, July 30th at the John Lomerny Center from 8:30 a.m. to 5 p.m. Please note that Bel Air and CPS will be closed on this day. We ask all persons who have an appointment to come to the John Lomerny Center. On Saturday, keeping up with the trend that's been started with the pop-up locations, we will have vaccination clinic at the Melford Hazel Sports Complex from 9 a.m. to 3 p.m. For persons who may be residing or tuning in from the French side, I am encouraging you to go to the Vaccinodrome in Gaddies Bay, which is open from Monday to Saturday from 8 a.m. to 4 p.m. Vaccinations help save lives. Please do your part in keeping St. Martin and its residents safe. Thank you very much, and I'm available for questions.
Thank you, Minister DeWeaver, for your opening remarks. At this time, I would like to invite the Prime Minister and Minister of General Affairs, the Honorable Sylvia Jacobs, to address you. Prime Minister Jacobs, you have the floor.
Thank you very much, Relaika. Good morning to my colleague ministers. Good morning to the members of the media here present and those following, as well as, of course, to the people of St. Martin following via whichever medium. And, of course, my great support crew at DCOM. Thank you so very much. I do not have much to update the people of St. Martin with this morning. A lot is still ongoing. What I can mention is that the technical teams that have been working on the, let's say, the preparation for the NADA report for the COHO have been hard at work vetting the last documents in a sense of ensuring that all that had been negotiated for were actually included in those final documents so that it can make its way. Once we've received those final checks and balances, then we'll be forwarding it on to our Council of Advice, as has been reported already over the past week. We're very happy that even up to the last minute, some of St. Martin's major concerns were addressed, as well as the other countries, and so we look forward to getting that final product. I will be updating the members of Parliament in a written brief, and looking forward to the discussion with the committee moving forward. The Council of Ministers was also able to have a very fruitful meeting with union members related to the cuts that had been implemented that would affect civil servants and others. And we have, I must say it was a fruitful meeting. However, I will leave the details to the joint press release, which will be released at some point later today. Not only was the meeting very fruitful, but let's say the stage has been set for continued collaborations and discussions on a quarterly basis through the CCSU, with other meetings being possible outside of that platform by committees formed through the decisions made in those meetings. So that being a very good step moving forward. This discussion was also had last year, but seeing as how things went, I must say communication did break down, but I'm very, very happy with the manner in which the communication continues to improve as we move forward. I'd like to also take the time to congratulate the Princess Juliana International Airport rescue and firefighters as they celebrate Firefighters Week this week. I was there for the opening on Sunday morning, and they were able to receive their insignias and stripes that they had been long awaited. So I must say congratulations to them and congratulations to the airport to ensure that our airport has the highest level of protection for safety and security of not just the passengers, but also all airport workers and the community at large. As you know, they substitute and assist our local fire department as well. And they did, in fact, start out 24 years ago from the island government of St. Martin. As you know, we're still in the hurricane season, so continue to have your preparations at the highest possible level. And though the Minister of TEAT, Acting Minister of VSA, already mentioned where we are now, I want to reiterate that though the Delta is only now accounting for 37.5% of our current cases, it is still on the island, and we know that it rapidly increases infectious rates, etc. We do have one person in hospital now, and I do not want our people of St. Martin to become complacent. We are now at 57 infected, 5 to 7 per day. You can do the math, what can happen in the coming weeks. What I've been hearing from just on the ground is, I understand COVID fatigue and the like, but a decreased amount of mask wearing in public gatherings. I do understand to eat and drink that you need to do this, but when you are out and about in public gatherings with persons you do not know the status of, you are therefore exposing yourself to whatever variant may be prevalent at the time. And though you may be vaccinated and there's a lower chance for transmission, you can still get infected. So though the vaccine can protect you, you can take it home to someone who is not vaccinated. And though we have not mandated vaccinations on St. Martin, we have strongly encouraged people of St. Martin, residents on St. Martin, to get vaccinated to protect yourself and your families. It is, I think, for me, it was the biggest fear to be able to take the virus home or take it to, for instance, my uncle in the St. Martin home, who is elderly, and around other persons who are elderly. I don't think any one of us want to be responsible for the death or the demise of a family member, a loved one, or even someone you don't know, to inadvertently have infected them. So I would say, please, carelessness has led to a lot of what is going on now. People knowingly, if you have some type of symptoms, knowingly going out and hugging and kissing and greeting because you haven't seen people in a long time, this is what is leading to the spread. And we do not want to have to go back to that situation. We've been there before, and I must say St. Martin has been exemplary in being able to remain open despite what's going on and keeping our people safe. We do not want to go back to the situation from a few weeks ago where we have to be in tears for any loved ones. And so I'm asking the people of St. Martin, if you refuse to be vaccinated, continue to maintain the highest level of safety for yourself and your families by continuing to wash your hands as often as possible and wear masks when you are around other persons. This is for your own safety. This will reflect on the whole community, and as such, we will be then able to get back to a higher level of normalcy. But again, vaccinations, and we're seeing all the persons, practically all the persons who have become infected and seriously sick over the past month or two have been persons who are not vaccinated. Last year, this time, we did not have a vaccination. Today, we know what can stop the virus. Our behavior and increasing our ability to fight off the disease by having the vaccination. So I encourage you to go out there and get vaccinated. I'm very proud of the health department and the VMT for continuing to roll out the vaccine, even though initially we were expected to stop at the end of this month. So that's good news. You can continue after this week from August 2nd at CPS throughout the day, and we will put those announcements out as often as possible via DCOM. And of course, my staff has started to also again promote Booster Man, boost your immune system, make sure you're eating healthy, make sure you're getting lots of exercise and rest, because it's total mind, body, and soul that can help you to fight off this and any other viruses. I do have a message also from the finance minister, and I need to find it, sorry. So from the finance ministry, I can inform that the unemployment and income support portal will be open as of today, Wednesday, July 28th, 2021, for the July 2021 recipients. However, due to administrative delays, July 2021 payments will be slightly delayed. So unfortunately, that's the only news I have from the Ministry of Finance, who I'm sitting in for at the moment. And I look forward to any questions that I would be able to answer at this time. Thank you.
Thank you, Prime Minister Jacobs, for your opening remarks. Before we go to the question and answer session, I would like to re-invite the Minister of Tourism, Economic Affairs, Transport, and Telecommunication, the Honorable Ludmila De Wever, to address you. Minister De Wever, you have the floor.
Thank you, Ms. Roach. I completely forgot to at least give a silver lining in our serious message that we have to share most of the time on Wednesdays. As of yesterday, anybody who's purchasing the insurance for arrival to St. Martin from August 1st or later is now being charged $15 instead of $30. And the reason that happens is because it's a reflection on the fact that our arrival numbers are increasing so much that we are in a better position where we can negotiate better rates. It's like bulk buying. The more people come, the less the prices, the cheaper the prices. So that is good news for us as a country, because even though people are happy about this service that we are offering, this insurance, which is part of our risk management with COVID so that we can be open, the fact that it's getting cheaper with the same coverage is an excellent opportunity for us. So that was what I forgot to include. So thank you very much for giving me this chance.
Thank you, Minister DeWeaver. If you've just joined us, you are watching the live Council of Ministers press briefing for today, Wednesday, July 28th, 2021. Thank you for joining us. We now move on to the question and answer session, and the floor is open. Bibi Shaw of SMN News, you have the floor.
Good morning. Thank you, Rolika. Good morning, colleagues and ministers. Minister Richardson, I understood your press release regarding the death of the mental health patient and your announcement. I'm not going to go into the investigation, Minister Richardson, but there are procedures prior to the death. What I'd like to know, the law clearly states, Minister, that before putting a person in restrictive custody, either you as Minister of Justice have to give an order or the court. I'd like to know, Minister, if you gave permission for the restrictive custody for Mr. Thomas, and if you did, Minister, who was responsible for the surveillance of that person while in custody? Now, Minister, also, I'm sure you're following the news. The situation at mental health is alarming. 4 or more unnatural deaths, a number of court cases. At a time like this, Minister, and I understand you have an investigation, but I also would like to know, Minister, what is the role of the Inspector General who is supposed to follow up on cases like this, especially patients that are placed in restrictive custody?
Good morning, Ms. Shaw. Again, whilst I understand the depth of your question, and I think it is a very valid one, I will maintain the position that I stated in my opening statements and indicated that we will reserve the right to be able to wait until this investigation has been concluded and all the pertinent information that is needed will be shared.
Thank you, Minister Richardson, and thank you, Bibi, for the question. I would now like to invite Ralph Cantav of Phillipsburg Broadcasting. You have the floor.
Can you give an update on the finalization of appointments of the board members for the SED, the Electoral Council, APS, and the Airport Holding Company? Thank you.
Good morning to you, Mr. Kantav. Indeed, the finalization, I believe the last time I updated where the SED is concerned, the last member is to come from the Employers Association. There are 2 associations. Both were asked to submit their list of members in order to determine which of the 2 had more in order to finalize that. One in particular is awaiting the outcome of a court case that they have started, which I was updated is going to be held on the 23rd of August. And so that is held up as a result of that. All attempts that I have made to have that person, that last person, the 9th person appointed, has been thwarted. In the meantime, we've had meetings with the Secretary General and let's say the working staff of the SER who are able to handle advices and the like. They just wouldn't get voted on by the board. And based on the discussions had with them, I have extended a mandate to the Secretary General to ensure, because actually there's nothing stopping them from meeting. However, because of only having 8 members, they question what they would do in case there's a tie. So the mandate that I have issued, which should be finalized if it hasn't been, is being vetted by Legal Affairs at the moment. So hopefully by the end of the day today, they will have that mandate to be able to meet on whatever is pending to be decided on. I have also met with with the organization, the SG and the researchers, etc., to start the process on the cost of living, doing a study on the cost of living. And so that they have started already with. But of course, for the board to be able to meet, the SG will be receiving the mandate to call the meeting and to be that tiebreaker if necessary, if there's a vote that requires such. So that is where we are at the moment, awaiting the outcome of the case. I don't have off the top of my head the information related to the Electoral Council. I will have that forwarded in writing for you. And where the holding board is concerned of PGIAH, there has been some movement indeed. There has been 2 members are no longer there, and 2 new, or should I say in the order of 2 new members were appointed and 2 were dismissed. So I don't know exactly what you wanted to know there, but we have a viable board, and the managing director prior to that had also resigned. I don't have that information at the moment, so any other information you require related to boards, please send that in writing, and I'll have my communications team communicate such to you.
Thank you, Prime Minister Jacobs, and thank you, Ralph, for the question. I would now like to invite Jacqueline Hoffman of the Daily Herald. You have the floor.
Good morning. Minister De Wever, I would like to ask you a question related to VSR. The Mental Health Foundation has the mandate from government for the treatment for all mental health patients on the island. Yet, there are certain groups like children, elderly people with geriatric problems, mentally handicapped, and those that have been in prison set out their sentence, but got a reduced sentence because of they were not fully accountable for their actions. These people are refused treatment. So if the Mental Health Foundation has the mandate for all patients and these groups are left out, my question is, why can't they be treated by the 2 doctors that have experience in this and their decrees were revoked?
Thank you for the question. I remember that a similar question was asked to Minister of VSR regarding the revocation of 2 license holders beforehand, and I have to apologize that I do not know, I cannot remember the response related to that. Because of the detailed nature of your question, I don't have a response for you at this moment. I will have to go back to the ministry to get an answer to that. Because if I commit myself to any answer that I personally feel, I will be putting the minister at a disadvantage to follow through on something that I say that I don't know enough about. While I am here as Warneman VSA, I am basically covering for emergency situations and the regular continuity of regular signing off of documents, basically. So in regards to mental health, I will have to look into that. I do agree with you that we have an issue on the island when it comes to mental health and the care. You see it on the island a lot more, especially after COVID-19, whether it is persons that are homeless or persons that develop mental health issues because of the circumstances that we are living in. We do have an issue. We have all taken notice of it. The fact that you even have the Ministry of Justice involved, because in certain circumstances, police are being called to assist with a person that has mental health issues. And so we do have to figure out our plan for that, who don't fall under the responsibilities of mental health. So I thank you very much for the question, because you bring light to an extremely important situation. What I can tell you from my perspective as Minister of TAYAT, that it is something that I had, it's a discussion that I had with the Mental Health Foundation when I came into office, that the Mental Health Foundation is not just a Ministry of VSA responsibility. It is also very important for tourism, because of the fact that we have a significant amount of tourists, based on the data that I have collected prior to COVID, who even come off a cruise ship that require assistance from the Mental Health Foundation. So it's not just a service that we are providing for our residents here, for our community. Part of our community are visitors. When visitors run out of help of their medicine, when they run out of options for help, they go to the Mental Health Foundation as well, and they are subsequently billed for that. So there is a far-reaching aspect of mental health that is much, much, much more than our community care. It is definitely also something available to our visitors, which is why I have asked the ministry since last year to figure out how we can incorporate any sort of contribution to mental health, because of how much it impacts the tourism sector. Thank you very much.
Can you take the mic? Sure, with a follow-up.
just wanted to ask, because if somebody commits a murder and they are not be held fully accountable of their actions, they get a shorter sentence. So there's people now that have, they're free from prison, they're out on the streets and not getting any help because the MHF regards these people too dangerous. If they're too dangerous to be treated at a clinic, they're also too dangerous to be in the streets without treatment. So if you talk about tourism and people, in the streets and confronting these people, it's like a national issue, I think.
Absolutely. That's exactly why I said my comment about how it relates and why it's important also for tourism, and why I understand and have made note of the responsibility and the contribution that we can give to assist a foundation like Mental Health, which has struggled with their budget. Thank you very much.
Thank you, Minister DeWeaver, and thank you, Jacqueline, for the question. I would now like to invite Lyndon Brown of BCN TV. You have the floor.
Good morning to the people of St. Martin and the ministers that are present here today. Question to Minister of Justice. Minister of Justice, there's a hype on Mr. Thomas' death. But recently, there was two young ladies by the name of Colette Julian from Colby and Delris Canigita, who was mental patient and they passed away. Minister, do you know if there are any investigation in process?
Thank you for your question, Mr. Brown. Whenever there is any sort of passing, regardless to the person's mental state, of course, an investigation would be underway. So I don't have any specifics into these persons who you've mentioned, but I am pretty sure that indeed an investigation and pretty much so, and possibly an autopsy is being taken place for these passings. But at this time, I don't have any information to share.
It was about a year ago. You can take the names down, Delris Canigita and Claudette Julian. So you can follow up on these mental patients that have passed away. And I don't want to mention rumors. So you can do the right thing.
Noted, Mr. Brown. Thank you.
Yeah.
Thank you, Mr. Brown, and thank you, Minister Richardson. Prime Minister Jacobs.
Thank you, Ralaika. I felt the need to add a comment or two related to this issue. First of all, I don't believe the press briefing is a place to be calling people's names, personal names. There are families involved. This is a very small community. If persons are aware of a death having occurred that is not natural, usually a doctor determines that, then there is usually an investigation. If that has not been the case in the two persons who were mentioned here before, then it is something that a complaint has to be lodged in order for an investigation to take place. Because I happen to know personally one of the persons, I do not know if that was the case indeed or not. However, if a family member suspects that a loved one has passed by unnatural circumstances, then a complaint has to be lodged in order for an investigation to take place in whichever circumstance, whatever, as mentioned by the minister, whatever mental capacity the person has. I also take note of the question related to what was mentioned. One of our laws is actually restricting family members from admitting loved ones who may or may not have mental issues based on their age. So that's where the law usually comes into place, that the person would have to be caught doing something, breaking the law, for the law to determine and the court to determine that they be remanded for psychiatric assistance. So it's a vrijwillige, a voluntary, the person, once they're an adult, it's a voluntary, so most people that we would see are persons that refuse assistance as well. So we must take that into consideration and their rights to refuse. And it's only if they become a danger to themselves and or others is where the law can take over. That's the way our laws are, similar to in the Netherlands, etc. And we do know that there is a rise in awareness of mental health problems, and we can see it in all the evidence around and with everything else that we've been dealing with. And I think a lot of people are negligent to the fact that we have gone through quite a lot in the last 4 years, from the hurricanes come to now. And some people who are only going through the pandemic and haven't had a major disaster in their lives are having a hard time in other parts of the world. So with our limited resources, we are doing the best we can. We're happy to see that the Mental Health Foundation is going closer to their goals. And as you know, as government, we have prioritized ensuring that they're assisted to get a facility. So facilities have been a problem. Having persons, it's like constantly the more persons you hire, the more you need. And for a small island, that can be very difficult where resources are concerned. So we are doing the best we can, and we will see what can be done in the short term to improve what we are experiencing now with the high rise of cases. But it does have our attention. Thank you for your concern.
Thank you, Prime Minister Jacobs. I would now like to invite Jeffrey Dr. Sokrin of Island 92 Radio. You have the floor.
Thank you, Rolika, and good morning to all of the ministers. It's nice to see everyone today. This question is for Minister De Wever in her capacity as acting Minister of VSA. Minister, I was wondering if you might be able to give us a little bit of insight as to where we stand on the process for the finalization of the QR code for when folks are traveling in Europe, so that our data will be automatically linked into the system that's used by the Netherlands. So when folks are traveling this summer, residents are traveling on vacation this summer, they're deemed appropriately as vaccinated. About 2 weeks ago, we were told that it was about 2 weeks away, and I don't know if your office is hearing it, but our phone is ringing constantly at the radio station with this particular topic. Thank you, Minister.
Thank you, Dr. Salk, for the question. Indeed, I have been receiving some questions on it. What I do know is that there is a QR code generation when people apply, when they fill in the form online. Whether or not that is compatible with the system in the Netherlands is what I do not know. I was actually due an update this week. I am going to be in acting Minister VSA until Monday, I believe. But I was due an update on that beforehand. And if the update does come beforehand, then I will be sure to make an announcement. Thank you very much.
Thank you, Minister De Wever, and thank you, Dr. Salk, for the question. I would now like to invite Stephen Cerulean of PJD2 Radio. You have the floor.
Thank you, Ms. Roach. Good morning to you, Prime Minister. Mrs. Good morning to you as well. My question is directed at the Minister of Justice. Simply annoyed, Minister. On a daily basis, what we've been seeing is more visitors to the capital of Philipsburg. More and more vehicles parking on the sidewalk. What has been done to expeditiously deal with that situation once and for all?
Yes, thank you, Mr. Cerulean, for your question. Indeed, about a year ago, almost a year ago, the Ombudsman indeed provided an extensive report and query to the Ministry of Justice to be able to deal with the parking and towing policy. I'm happy to say that the ministry has been working on said policy, and we are coming up with the finalization of that. So I'm hoping that within the coming weeks, we will be able to publish this policy, and for, as you so put it, once and for all, we would be able to tackle this matter, because indeed it is really a hindrance to our pedestrians and those that are visiting the islands. Despite the call and request of drivers of these vehicles to please be considerate and not utilize the sidewalk that is visibly a sidewalk to park, that has gone unreceived. I'll put it like that. So indeed, we are finalizing the policy, and I look forward to that coming to publication pretty soon. Thank you for the question.
Thank you, Minister Richardson. Minister De Wever.
Thank you, Ms. Roach. And Mr. Cerulean, thank you for that question. I definitely wanted to chime in after Minister Richardson, because it is something that I have also said publicly. And I will just repeat what I said last time. We are heavily reliant on tourism. Our tourists are going to be coming off a cruise ship at the port, walking over or driving over to our capital. Our capital is something that we should have in the best state possible. Today we have 2 ships in port. We have Celebrity Equinox and we have Seabourn. And knowing that we have 2 ships in port, knowing that we have persons that live here that are setting a bad example to park on the sidewalk, to park in areas that are not designated parking spaces, and having our visitors follow suit because they were leading by example. We're setting an example that visitors can also park. What is unfortunate is that there is towing that takes place. And because we are setting a bad example for our visitors who don't know better, because we are in the process of still obtaining signs to say where you can park, they subsequently get towed as well. So the experience, the overall customer experience becomes a negative one. And what I will ask is that I have personally seen business owners who park in front of their establishments. I have seen residents who park in front of businesses. I have seen businesses who put out planter boxes, who put out rocks, who put out fixtures from their stores. It actually all adds to the aesthetics of our capital, where we look like a mixed match, have no rules capital. So I am going to ask the public and take this opportunity to please help us. Our economy is 80% dependent on tourism. Before we can go into diversification, which we need, I am please asking the cooperation of everyone. Like I said, we are not averse to towing cars. We do. We just get limited space when you realize that we have to tow 50 cars from our capital, Phillipsburg. So I am please asking again, pleading with the public to respect the fact that we are lucky enough to have crews to come back to our shores and help us to make it a better experience for our visitors and not just only us. Thank you very much, Mr. Cerillion.
Thank you, Minister DeWeaver. Members of the media, as we do have an extensive media presence, this will be the final round of questions, and I would also like to inform the Minister of Public Housing, Spatial Planning, Environment, and Infrastructure, the Honorable Egbert Duran, is also available for any questions the media may have. Bibi Hatshaw, you have the floor.
Thank you, Rulaika. Prime Minister, thank you for the additional information that you gave regarding mental health and the procedure as to how somebody can be restrained. Hence my question as to the procedures and the role of the inspectorate, because I've had a number of families of mental health. They file complaint, they ask for an investigation, and 2 years goes by, and they cannot get the report from the Inspectorate of Health. That's why I asked that question. So when you guys are investigating or looking into this, I'd ask that that part be looked into. My question, second question, thank you, Minister Doran, for joining us. A year and a half or even more. The situation at GEBE, you had 1 week to look into the last or the latest situation. Can you give us an update? If not for the CEO position, that probably will take more time, what is the situation regarding the order that was given for the other 2 candidates to be appointed? Where are we with this? Thank you.
Good morning. Good morning, members of the media. Good morning, Rulaika. Good morning, Prime Minister, colleagues, and a special good morning to the people of St. Martin. Thank you for your question, Bibi. At the moment, as you rightfully stated, the COM appointed in the last shareholder meeting, I believe it was July 2nd, the COO and the CFO. At the moment, the board is busy in negotiations with the contracts and the specifics of that with the respective individuals that were selected. And within short, that should be finalized because everything has been approved thus far. So right now, they're in the negotiation stage with the respective candidates.
Thank you, Minister Duran, and thank you, Bibi, for the question. I would now like to invite Ralph Cantab. You have the floor.
Thank you. My question is for the Minister of Justice. I took note of the positive news of the collaboration with the Ministry of VSA where domestic abuse is concerned. But what is the ministry doing or have done in relation to a sex offender registry?
Very good question. Thank you very much. That indeed has been on the table of discussion, and just as we collaborated interministerially to be able to develop a policy when it comes to domestic violence, I can, positively say that this Council of Ministers is working together very, very attentively to be able to address various aspects of matters that are plaguing our communities. And indeed, quite recently we had a discussion to that same effect, and I'm happy to say that we are looking forward to developing a policy where registration of sex offenders is underway. Thank you for that question.
Thank you, Minister Richardson, and thank you, Ralph. Jacqueline Hoffman, you have the floor.
Prime Minister, as you just told us, 24 years ago, the rescue and firefighters were established. Now, part of that group from the first group have received a letter saying that they're a firefighter in training, so an aspirant. How can they, after 22 years, get that letter?
Thanks for that question. During the celebration and the research that led up to it, in preparing for that, that was not brought to my attention. What was brought to my attention is that the firefighters, one of the, I believe it was the chief at the time, informed that though they had had trainings prior to starting as airport firefighters, once they had to go under particular international certification, they had to follow courses all over again. So even ones that had been certified for years had to be recertified according to those standards. And that's where then everyone started out again from the beginning. So I'm not sure that that is something recent. I believed in the way it was told that was something that happened over the course of the years. So the majority of persons who received their insignias were 2, 3, and more stripes, and even one captain, and of course the chief. So I'm not sure that that's a current situation, but if it is, then I'll hear it more directly and allow them to provide the information to substantiate what I've stated here.
Thank you, Prime Minister Jacobs, and thank you, Jacqueline. I would now like to invite Lyndon Brown. You have the floor.
Question to the Minister DeWeaver, and I'm gonna tag it in. I can tag in the Prime Minister also. Prime Minister, there was a insurance, CRIF, I think is a Caribbean disaster insurance. Prime Minister, you can mention about it. Is it still existed? CRIF, the Caribbean insurance in case of disaster, and also the booming in tourism. Minister DeWeaver, you just come in time. The harbor is booming and the airport is booming. There was yesterday there were a lot of planes. So tell us about the numbers.
Thank you, Mr. Brown. I don't know if the CRIF insurance was related to me. That's okay. That's PM. You make a statement that I came just in time. I didn't come in just in time. I was part of the solution to opening up the country when I was called crazy on the floor of Parliament. So I'm just going to correct you there. But it wasn't me alone that was doing it. It was me with the work of the ministry, with the work of my colleague ministers, and with the work of the airport, the stakeholders, and the port. Stakeholders include the cruise lines and the airlines, because I had direct dialogue with all of them, saying, what do you need to come here? How are you going to come here? How often are you going to come here? So I didn't come in time. Just going to correct that. So in regards to our numbers for the summer, I know that we had a slight drop in arrivals from last week, not a significant drop. It is still over 11,000 passengers per week. We sort of peaked at 12.2, I believe, arrivals coming in. We had a significantly higher departures, but you can understand that because we are in the summer months. So of course departures will be higher because we have our own residents here that are traveling for the summer holidays. On Sunday, I will get an additional update of what happens this week, but the good news is that we keep going above 11,000 per week. And as I mentioned earlier, we have 2 cruise ships in today. So please don't park in Front Street on the sidewalk and block the passengers so that they have to walk in the road. We also have 2 boats on Saturday, which are both the home porting boats. The Celebrity and I believe Windstar is the other one. So all in all, that's 4 more than we had 2 months ago. So we are heading in the right direction. We will continue heading in the right direction. I continue my dialogue with the Minister of VSA, Minister Otley, to ensure that our protocols for cruise calls are consistent across all of the lines, which is what we're doing now so that we can get more calls. But again, even in my dialogue with them this week, we are probably going to get more than we expected because of the fact that other islands are taking a significantly, I would say very, very cautious because they weren't even opened yet to cruise lines, and they're going to extend their closure to cruise line and travelers coming in by air. So we are hopefully going to be able to benefit from that, but I will have more information for that by the end of the week. Thank you, Mr. Brown.
Thank you, Minister DeWeaver. Prime Minister Jacobs.
Yes. Regarding the CRIF, I believe that we have extended lots of press on this. We are currently insured. We have been for the past few years, and it continues to be covered up until, I believe, 2022 or 3 by the trust fund. We are covered for tropical cyclones, earthquakes, excessive rainfall, so tropical cyclones being hurricanes. Of course, you would have to sustain a level of damage to be able to trigger the funds. So we're covered.
Thank you, Prime Minister Jacobs. I would now like to invite Dr. Salk. You have the floor.
Thank you so much, Rolika. I would like to address this both to our Prime Minister as well as Minister DeWeaver. When we look at the vaccination numbers to date, we've done about almost 45,000 doses of the 88,000 doses required and change to hit our goal of vaccinating 85% of the population. I think it's safe to say that the hesitancy is still out there. We're no different than anywhere in the world. We're seeing, Prime Minister, you used the word mandate, and we're seeing major cities around the world and countries around the world issue mandates for government employees, municipal employees to be vaccinated. If you don't want to be vaccinated, be tested on a regular basis. So we're seeing that happen. We're also seeing some, with the spread of the Delta variant, we're seeing some research that's starting to show that a 3rd dose of the Pfizer vaccine might also be in the cards. Are we, from a VSA perspective, considering a 3rd dose? And then from a mandate perspective, Prime Minister, are you thinking that a mandate might be appropriate for the island? Thank you.
I don't think we're there. We have seen a very high compliance with our people on St. Martin. I don't think people of St. Martin, all around the world, when I have those regional and international meetings with leaders, they are in awe of how St. Martin, as a small country, has handled it. I can't say we did it on our own. As you know, we've been in close contact from the very beginning, getting a lot of assistance for the vaccines, for medical resources and human resources last year. Luckily, we didn't even have to engage them as we'd expected, and they've in the meantime left. They were able to even assist Curacao and others that had outbreaks, which we did not have to that extent. We were also dealing with the serious situation we have with having our northern neighbors with completely different constitution and sitting under the rules and regulations of the state. As you know, that also plays a role by us, and with the situation being how it is in France at the moment, the mandate that has been put out by the president there has basically put the island in an uproar as well, because there's the anticipation that it will roll over to St. Martin. What I can say is, based on the way our population has reacted to that I don't think it's a good idea. It's not a good way to go. What we are seeing is that though we haven't achieved the 75 or 85%, and I'm not a medical professional, so don't quote me, based on the fact that we have had the Delta variant rampant on the island for more than a month and have not seen the type of increases in the thousands as other countries, I can only say, based on the fact that we're open, I can only say that the level of herd immunity probably is through natural infections over the past year that had gone underreported are accounting for that. I don't know if that's making sense to everyone, but I remember last year we were constantly told those numbers can be correct, those numbers can be correct, but those were the numbers that we had. Those were the reported numbers. Those were the persons who came forward and were tested. So we suspect that there are much more persons that did get infected over the course of the year, and that's why where the variants and where the virus is spreading is by unvaccinated or persons who do not have a level of immunity. So the fact that our numbers remain manageable, and I pray that they remain that way, is, I think, testament to the possibility of that. However, we still encourage persons because we've seen that even if you've had the virus, at least one dose of the vaccine can raise your level of immunity closer to the 90-somebody%, which we have with the 2 doses. So you've been exposed twice. And in my discussion with Dr. Deutz, that came out, which is the viral, I don't want to get stuck on those words, but the gentleman, the specialist who came in from Curacao, immunologist, I believe. And so for us as a government, we will continue to push that as many people get vaccinated as possible. Even back when we were contemplating to allow certain types of venues to open, it would be that the owners would then have to do a check on vaccinated or have testing done. But so far, we're seeing that it's manageable, and until it is necessary to go that far, we don't see it possible. And we've learned from our French counterparts that the prefecture will take the decision that is best for St. Martin. So they're allowed to deviate from the decision of the French state. So with that being said, I think together in synchronizing our measures, we should be able to keep it under control, and we continue to promote that those persons get vaccinated as soon as possible, and we're also making it available. So after August was a big question mark for everyone, and now we're seeing that vaccinations remain available at CPS for walk-ins, and so I encourage the people of St. Martin to make use of that opportunity to build our herd immunity to a higher level.
Thank you, Prime Minister Jacobs. Minister DeWeaver.
Thank you, Ms. Roach, and thank you, Dr. Stock. I just had a quick comment to add regarding the dosages and whether or not we would need a 3rd vaccine. From my understanding, the dialogue is there globally about whether or not we would need an additional sort of booster shot, but there's no concrete evidence or conclusion made from that it is indeed going to be the case here. I think that it's important that the dialogue is started so people are aware of it, but it shouldn't be a dialogue that deters you from taking the vaccine because it is important. The information that we've been sharing here is information that we receive from other islands, from other countries, where you have seen that the majority of hospitalized persons are those who are unvaccinated. I think that is a very, very accurate amount of data or statement that's coming from medical sources. And so that's not a story created, it's just the facts that we receive, that is the situation that we are dealing with today. So that is what I want to make sure that we're clear on, that there's no decision taken on whether or not we have to take an additional shot as of now, as of today. Thank you very much.
Thank you, Minister DeWeaver. And now I'd like to invite Stephen Cerulean. You have the final question.
Thank you, Ms. Roach. And I'll get straight to the question. It's for the minister responsible for VROMI. Minister, can you provide a status update on the pending demolition of the government building and the post office?
Thank you for your question, Stephen. With respect to the demolition of the post office, that will commence very soon. A bidding process took place a couple of weeks ago. The winner was just, I was notified this week as to who the winner is based on the preliminary results. They just have to be verified, and then it will be made public, made known to the respective bidders who won. With respect to the Justice building, that bidding also, that's the Surma building, former Surma building in Colby. That bidding also took place a few weeks ago, which will, I expect to get the results from that next week, God's willing. And we still have to put out the government building because there is some studies that still needs to be done with respect to certain aspects of the entire project. So the post office will be awarded soon. Next week I will be getting the results from the Justice Building, and the government building is pending some technical situation that we face.
If I may, Mr. Rich, very quickly.
Unfortunately, Stephen, we are pressed for time. We are at our hour mark, so I will not be able to allow another question.
Okay.
Members of the media, thank you once again for joining us. Any further questions can be sent to the Minister's Cabinet in writing. Honorable Ministers of the Council, members of the media, radio listeners, and online viewers, this brings us to the end of the live Council of Ministers press briefing for today, Wednesday, July 28th, 2021. For rebroadcast, tune into St. Martin Gov Radio 107.9 FM, the official Facebook page of the Government of St. Martin, the YouTube channel Government of St. Martin, and St. Martin Cable TV channel 115. For video on demand, log on to Government of St. Martin's YouTube page. On behalf of the Department of Communication and the Government of St. Martin, I'm Rolika Roach and wishing you a pleasant day further.